We always talk about the birth from the mother's point of view, but what about the father? Hello! Today we are here with my friend Daniel, and Daniel is a doctor and he works helping giving birth to babies. So what's the biggest difference? How Sweden approaches the birth and other countries?
The big difference is in Brazil, in France, the doctor come in exactly when the baby is supposed to be born and delivers the baby. But in Sweden we have this culture that the midwife delivers the baby. The doctor only comes in if it's a complication.
We arrived there and we went to a room.
Yeah.
And I thought, okay, we're gonna be like a waiting room or something, just when the moment. And then no, the baby was born, the room we arrived, and the clothes I had from the street. Yeah. And this is in Brazil, it's not like that.
No.
Because you go,
you get special
clothes, like you
yeah.
look like a doctor in a surgery. Like one of the main reasons this channel exists is to talk about part of the parenting that normally people do not talk about. For sure, it's more important the mother and the baby than us. There's no discussion about it. But okay, but then what the men should do, because it's not so easy.
No, it's really tough. And I mean, even myself, despite that I know how it's supposed to do, and I'm a doctor, when it's time for my own partner to get a baby, I'm not good to see her having pain. I knew what to look for, you know, like in the charts and everything, but I was trying to just become the father and the father to be, or the partner, and that's hard. It was hard for me to do that. Before it was more like I tried to think as a doctor, but to the end I just became like the nervous partner as everybody else. I see a lot of fathers coming in, the first baby. They have, you know, their drinks with them, Powerades, their Red Bulls and everything like that. When the baby is delivered, in a way, then fatherhood starts.
Yeah.
Motherhood starts, you know, during the pregnancy.
Yeah.
She's being primed. Everybody around her tells her, what's supposed to be happening. But for the father, it's when the baby is out here.
Yeah.
Now I have to relax. I have done this for 9 months. Take him.
Do something, man.
Do something. The baby is crying. Do something. It's maybe. Get your sleep before the delivery, because you are going to need your energy. It's so easy to say now, but
so tip number one.
Tip number one: get your sleep before the baby comes. Most babies don't come 10 o'clock in the day; they come 10 o'clock at night or 5 o'clock in the morning, and it's not so easy to be awake. But I mean, the weeks before, try to get your sleep. So because when the baby comes, it's up to you.
I remember one thing that's also different. You don't wash the baby.
No.
After it's born. Here, the first shower was like a month later.
I don't know really if it's supposed to be that long, but I know because the baby has, you know, the baby fat.
Yeah, that's what they say. Yeah.
It's really protective against a lot of things.
I think it also related to the mindset of skin to skin.
Yeah.
So they say, okay, now you dad, take off your shirt, skin to skin. I don't think my brother in his fortune ever had this, skin to skin.
No.
Because they were being washed and he was in the surgery thing, and then when he took the baby was already wrapped.
Yeah.
There's a burrito. And
a lot of studies have shown, you know, that babies, when they are born prematurely, the body-to-body contact, skin to skin, is one of the most important things for the baby, because it releases hormone that is good for them.
Okay.
So that is why we in Sweden want the baby to come up to the mother or the father as soon as possible, because it's good for their immune system, for their being calm and everything like that.
I feel like here is more humanized delivery.
Yeah. Because I mean, here it's more like What is it? Hur är läget?
Hey!
Är du arg? Ja, du är arg. I think we have a good delivery system here in Sweden. We don't want to separate the baby from the parents. I think we have good data that it's a good result from that. Tip number 2, let your partner be in the center. Take a step back and see what she needs. It's not about your...
It's not about you anymore.
It's not about you.
Yeah.
It's about the woman and the baby to be.
Yeah.
And I think a lot of fathers are, they want to have control, they want to ask a lot of questions, they want to get briefings, but instead just take care of your partner, give her what she wants, give her a back rub, give her a drink, just take a step back. Right there and right now, the most important thing is that the women get the attention they need. Because it's hard to giving birth.
Well, I don't know. I imagine.
No, but
I will never know.
No. It looks hard to give birth.
Yeah.
It takes a lot of energy and it's painful.
As I was saying before, it's also so hard to be there. Yeah. It's so hard to pretend everything's fine. Yeah. And she's in pain. They gave her this local injections, and then they gave her the gas. I said something, next baby we do differently. And then she said, I will not have another baby.
You cannot tell a woman.
And then the midwife said, bad timing.
Yeah, bad timing. Yeah. It's not good to plan the next baby during the first delivery. That's maybe tip number 3.
Started being super mad at me, rude to me, but she was super sweet to the midwife.
Yeah.
So I said, babe, drink something. I don't want anything to drink.
No.
The second after, the midwife, come on, drink something. Okay. And the midwife started laughing because she knew the
midwife can help her with this situation.
What people say, like, oh, take like the pillows you used to have to sleep, and something I regret I didn't, and something to eat I regret I didn't.
Yeah.
You know, like a laptop, iPad.
Take a good music list you can play. Not too much heavy food. Don't eat Chinese food or Indian food before the
But you talk about the father or the mother?
Both of you, because you don't want to be able to go to the restroom because you have some bad Indian food.
So like, sorry, you missed your baby born because you were in the toilet.
Yeah, that's not a good excuse. That's not a good excuse.
It's not a good memory.
Yeah.
Like, oh, why you don't have a first picture with the boy?
No,
I was busy.
Yeah, exactly. I was busy. One good tip: if everything goes okay, partner is having a vaginal birth.
This doesn't sound so flattering. Vaginal birth.
No, but for us as doctors, that is a normal thing. Learn some massage tricks.
Okay.
Maybe bring your TENS.
Okay.
And massage her from the lower back and down.
Okay.
Because there is a pain going to be, and you will be the best dad in the whole world. Trust me.
For that moment.
For that moment.
For that half an hour.
I cannot account for anything else, but for that half an hour, you will.
Should the father have a different behavior between natural or C-section birth?
The operation takes maybe 30 minutes.
Okay.
And after that, the women usually have to lay in the post-operative ward for maybe 2 hours. And during that time, the dad has to be able to have the baby because
she can't have weight.
No, exactly. She cannot move her legs. During the C-section, stay on your side of the
Don't cross the line.
Don't cross the line because. And don't film us. One of the things that we don't like is when people just put their cameras and film us and film the operation and stuff like that. That is not good behavior, I think.
We have a surprise now. Have a new baby.
We have a new baby. Ja, de är där borta, men vi ska hitåt. Du ville komma med mig.
Let's go that way then.
Okej, kom då.
Okay.
Vi går hitåt.
Let's go to mama. Huh? Okay,
kom. Yeah. I mean, here in Sweden, why you can get a C-section, it's if the baby has a head up and the bottom down.
Okay.
If you are really, really afraid and have talked to a nurse and midwife and doctor, and you still cannot bear to have a natural, you can also have a C-section. And if like some complication preeclampsia or something other like that, and we do a C-section. And if you have a malformation in the uterus and the baby, we don't think it's safe for the baby to come out naturally.
And also if the mother has any kind of mental problems, right?
It depends. We don't think that she can go through a delivery.
Okay.
And if we don't think that the medication can be paused, then we can do it. But
Well, I had a lot of information, and I hope this would be useful for you that are already fathers, or the ones that are gonna have other kids, or the one expecting kids. I just can thank you very much, Daniel, for all this time and help and tips.
it's my pleasure. And maybe if we have, if you want to, we can do a follow-up. If you get a question to the,
For sure.
we can do a follow-up.
Amazing. So if you have doubts, like write in the comments, and
Exactly.
then I send the comments to him.
And we can do something.
Yeah.
My pleasure.
Thank you very much.
Okay.
Subscribe, like, comment, and see you next video. Bye.
Bra.